Christo-fascist forced birthers are in their find-out season. They may not all recognize that they're in their find-out season, but find-out season is here for them. Stripping away women's rights doesn't just hurt the loose and lascivious women, those women over there that are just using abortion as birth control. No, it hurts women that are trying to have babies, even Christian women. And if they voted against their own rights, then they get what they get. So this was out of Texas. Rural providers, advocates pushed Texas legislator to rescue maternal health care system. Almost half of Texas counties have nowhere to get prenatal care, let alone deliver a baby. This plan offers legislative proposals to shore up what's left because they are running medical people out of the state. Duh, because they are anti-woman and they are threatening to lock people up for providing care. Ken Paxton went to the Supreme Court to say, we want to let women die versus give them the care that they need. And they think that that's not going to hurt women. So they're getting what they voted for. 25 years ago, the Texas legislature passed a sweeping set of reforms to resuscitate the state's collapsing rural healthcare system. Now, healthcare providers, advocates, and local leaders are proposing similarly aggressive action to pull the rural maternity care system back from the brink. The Rural Texas Maternal Health Rescue Plan is a package of proposals they're hoping lawmakers will champion in this upcoming session. Almost half of all Texas counties offer no maternity care services, and more than a quarter of rural mothers live more than 30 minutes away from the nearest provider. Living in a maternity care desert contributes to delayed prenatal care, increased pregnancy complications, and worse delivery outcomes. Women living in rural areas are more likely to die from pregnancy or childbirth-related causes, and infant mortality is also higher. But despite these sobering statistics, more rural hospitals are closing their labor and delivery units, leaving patients to travel long distances or deliver in under-equipped emergency rooms. Most of those that do still deliver babies lose money in the process due to low Medicaid payments and too few deliveries to break even on round-the-clock staffing. We're reaching a tipping point where people are frequently more than an hour from routine prenatal care and more than an hour from a delivering hospital when their water breaks, said John Henderson, the president of Texas Organization of Rural and Community Hospitals. There's no way we're going to get the kind of quality or outcomes we want as a state when that's the reality. Texas A&M Rural and Community Health Institute convened more than 40 groups representing rural hospitals, healthcare providers, medical schools, advocacy groups, and nonprofits to create this rescue plan. They've identified the steps the legislature could take this session, including increasing Medicaid payment rates, incentivizing healthcare providers to work in rural areas, and improving overall women's healthcare access. And maybe stop stripping women's rights, and maybe stop going to the Supreme Court saying that we can just let women die in Texas. How about that? I don't think anyone thinks we're going to be able to restore services at 20 or 30 rural hospitals that closed or suspended their OB programs. But if we don't do something, we'll see more go the same way. Last session, the first session since the overturn of Roe v. Wade and Texas's near total abortion ban, lawmakers extended postpartum Medicaid to a full year and waived sales tax on diapers and menstrual products. Ahead of this session, House Speaker Dade Phelan listed improving access to rural prenatal and obstetrics care as one of his interim priorities. Strengthening access to rural maternity care would be a bipartisan way to show up for moms and babies in Texas, said Tom Banning, CEO of the Texas Academy of Family Physicians. There's not a silver bullet to this. We would have done it if there was, but we just want to bring forward ideas for them to think as possible legislation or funding strategies. That's what this report is intended to do, to give them options. Code Red proposals. Several of the top priorities focus on Medicaid, the largest payer of maternal health services in Texas. Medicaid pays for half of births statewide, but in rural areas covers between 60 and 90% of births. Medicaid is primarily federally funded, but states administer the program. This plan proposes reimbursing rural hospitals based on the actual cost they incur delivering a baby rather than a set rate, and offering doctors fixed monthly per patient payments to cover the cost of preventative, primary, and maternity care needs. They're hoping this will make it more financially appealing for hospitals to keep delivering babies and recruit the healthcare providers they need to do so. This part right here, recruit the healthcare providers they need to do so. It's like they do like these patriarchal countries that just can't get it right as far as why women won't have babies. They are not going to come there because these states are anti-woman and want to jail doctors for doing their jobs. So they're not, how are they going to recruit people, especially when women are saying, I am going to go to state out of this, I'm going to go to college or the university out of this state because they are anti-woman in this state. They need to get to the crux of the problem, but that would take examining their Christo-fascist forced birther ideologies. The state should also make it easier for pregnant women to get on Medicaid and easier for doctors to start accepting Medicaid, the report says. The administrative burden of being in Medicaid is substantial. Diana Forrester, the director of health policy at Texans Care for Children, a health advocacy group, is quoted as saying in the report, I talked to one OB group outside of Sweetwater that said they're the only birthing unit for that they're the only birthing unit for hundreds of miles. And they couldn't get enrolled in Medicaid, so they can't treat Medicaid patients. Last legislative session, lawmakers tackled the growing nursing shortage with scholarships, grants, and loan repayment programs, and allocated additional funds for graduate medical education programs in rural and community health. But much more is needed, this report says. The state urgently needs to strengthen loan repayment programs for OBGYNs, family physicians, and other healthcare professionals who practice in rural areas, and create more opportunities for medical students and residents to train outside of major cities. This plan also lays out ways the legislature could shore up rural women's health care more broadly, ensuring they are healthy before and after pregnancy. As one of 10 states that hasn't expanded Medicaid, Texas has a 21.7% uninsured rate, the highest in the nation. While lawmakers are unlikely to move on that issue anytime soon, they could allocate more money for state-run programs like Healthy Texas Women, the Family Planning Program, and the Breast and Cervical Cancer Treatment Program. They could also pour more money into mobile clinics and federally qualified health centers, safety net clinics that cover and underinsured Texans. In a legislative session focused on hot-button political issues like school choice, immigration, and property taxes, the groups that put together Rural Texas Maternal Health Rescue Plan are hoping to offer common-sense proposals that both parties can get behind. They'll be pitching these plans to legislatures in the lead up to the 2025 session. All these priorities are billion-dollar projects. What we're talking about is maybe $100 million. It's not a showstopper budgetary impact. Rural communities have figured out that if they stand together, they can stretch a dollar a long way. And in this case, it can be a force multiplier for other opportunities in those communities. We'll see what's going to happen, but why? If you are a normal thinking person, why would you go to school in that state? If you're a normal thinking person, if you actually care about women, why would you stay in that state to practice? Especially since they fought so hard to allow women to die, especially when they are telling you, I will put you in jail if you can't actually justify why you actually gave this woman a D&C or whatever this woman needed. Why? Until they get to that answer, more people will continue to leave. And like I said, these people are in their find out season. They just haven't felt it yet, but they will. Join the conversation. Let me know what you think about this one. Don't forget to like, comment, and share. What the Taliban is doing to women is egregious. And the things that they're doing don't even make sense. But, the big brains of these male leaders is just highlighted right here. Afghan women banned from midwife courses in latest blow to rights. Taking women out of school, taking girls out of school is already egregious, but not wanting them to be able to study for the healthcare purposes of other women is like they're furthering their own demise. Women training as midwives and nurses in Afghanistan have told the BBC they were ordered to not return to classes in the morning, effectively closing off their last route to further education in the country. 5 separate institutions across Afghanistan have also confirmed to the BBC that the Taliban had instructed them to close until further notice, with videos shared online showing students crying at the news. The BBC has yet to confirm the order officially with the Taliban's government health ministry. However, the closure appears to be in line with the group's wider policy on female education, which has seen teenage girls unable to access secondary and higher education since August 2021. The Taliban have repeatedly promised they would be readmitted to school once a number of issues were resolved, including ensuring the curriculum was Islamic. This has yet to happen. One of the few avenues still open to women seeking education was through the country's further education of colleges, where they could learn to be nurses or midwives. Midwifery and nursing are also one of the only careers women can pursue under the Taliban government's restriction on women, a vital one, as male medics are not allowed to treat women unless a male guardian is present. Just 3 months ago, the BBC was given access to one Taliban-run midwife training center where more than a dozen women in their 20s were learning how to deliver babies. The women were happy to have been given the chance to learn. "My family feels so proud of me," a trainee called Safiya said. "I have left my children at home to come here, but they know I'm serving the country." But even then, some of the women expressed fear about whether even this might be stopped eventually. What will happen to those women and another estimated 17,000 women on the training courses is unclear. No formal announcement has been made, although 2 sources to the Ministry of Health confirmed the ban to the BBC Afghan off the record. In videos sent to the BBC from other training colleges, trainees can be heard weeping. "Standing here and crying won't help," a student tells a group of women in one video. "The vice and virtue officials who enforce Taliban rules are nearby, and I don't want anything bad to happen to any of you." The other videos shared with the BBC show women quietly protesting as they leave the colleges, singing as they make their way through the hallways. One Kabul student said she had been told to wait until further notice. "Even though it's the end of our semester, exams have not yet been conducted and we have not been given permission to take them," she told the BBC. Another student revealed they were only given time to grab our bags and leave the classrooms. "They even told us not to stand in the courtyard because the Taliban could arrive at any moment. Something might happen. Everyone was terrified," she said. "For many of us, attending classes was a small glimmer of hope after long periods of unemployment, depression, and isolation at home." What this means for women's healthcare also now remains to be seen. Last year, the United Nations said Afghanistan needed an additional 18,000 midwives to meet the country's needs. Afghanistan already has one of the worst maternal mortality rates in the world, according to the World Health Organization, with a report released last year noting 620 women were dying per 100,000 live births. So that is what's going on with these male leaders over there that have taken control and are just doing all that they can to oppress and squash every last bit of hope from women. Join the conversation. Let me know what you think. Please share this. I don't know how else to help these women and girls, but let's share and keep shining the light on what the Taliban are doing to the women of Afghanistan. Like, comment, and share. And yet another story of women's rights being trampled on. Iran passes new hijab law amid growing defiance from women. Iran's parliament has approved a new law introducing severe penalties for not wearing a hijab in public. This move comes despite repeated criticism of such restrictions by Iranian President Masoud Pezeshkian. The Iranian parliament has approved the so-called Hijab and Chastity Bill, which mandates women to wear hijabs and introduce strict penalties on those who do not. Since the 1979 Islamic Revolution, women in Iran have been required to cover their hair in public. Increasing numbers choose not to wear hijabs, especially since the 2022 death in police custody of Iranian Kurdish woman Gina Mahsa Amini. The 22-year-old had been arrested by Iran's morality police for allegedly violating the country's strict dress code. This is a picture talking about the growing number of women not adhering to the hijab regulations. All right, it says Amini's death sparked widespread protests, largely led by women and schoolgirls calling for political change. It also inspired the Women Life Freedom movement, which challenged the authorities' enforcement of the hijab mandate. The Hijab and Chastity Bill was drafted by the Iranian judiciary on the instructions of former President Ibrahim Raisi in response to the increasing reluctance of many women to wear the hijab. What does the new law say? Iranian media reports say the legislation imposes fines equivalent up to 20 months of the average salary for women who improperly wear a hijab or forego it altogether in public or on social media. Fines must be paid within 10 days, failing which violators will face restrictions on access to government services, such as the issuance or renewal of passports, driver's license, and exit permits. Mary Mohammadi, a US-based Iranian political analyst, told DW that the law aims to hinder women by making their struggle too costly. It seeks to prevent the advancement of women's demands, bolster the morale of the regime's ideological supporters, exhaust the psyche of society by creating all-encompassing conflicts in daily life, and weaken the revolutionary potential led by women. The legislation requires institutions to provide CCTV footage to help police identify people opposing the compulsory hijab. Noncompliance will result in fines or the dismissal of the institution's officials. It also criminalizes the design or promotion of such items such as clothing, statues, and toys deemed to encourage nudity or lack of veiling. The Industry, Mines, and Trade Ministry has been tasked with monitoring clothing producers and suppliers to ensure garments comply with hijab legislation. Pezeshkian's hijab dilemma. The law was passed by lawmakers 4 months into Iranian President Masoud Pezeshkian's term. Pezeshkian, who is widely viewed as aligned with the reformist movement that advocates for greater freedoms and better relations with the West, criticized the strict enforcement of hijab regulations during his election campaign. Many of Pezeshkian's supporters had hoped that his administration would ease the rules surrounding compulsory hijabs. However, critics argue that compulsory hijab enforcement lies beyond the government's direct control. In a broader view, the disagreement over its implementation between the hardliners in the Islamic Parliament and the so-called reformist Pezeshkian in the administration is a staged display of internal regime conflicts over the mandatory hijab law. More than 2 years after the death of Mahsa Jina Amini, and despite heightened threats and additional security cameras in cities, many women still appear in public without hijabs. In practice, Iranian women themselves have eliminated compromise and tolerance from their options, defining only 2 paths for themselves, death or freedom, Mohammadi said. What happens next? The Iranian parliament has forwarded the law to Pezeshkian for his signature, which is required before the law can take effect. Under the country's constitution, the president has the authority to withhold notification to relevant agencies, effectively delaying enforcement. Activists and women's rights advocates have urged Pezeshkian to exercise his authority and refrain from enacting the law. Restrictions and pressures on women in Iran persist, with the law even amplifying concerns among some officials within the Islamic Republic. They anticipate that opposition to the legislation will extend beyond social media, potentially sparking a new wave of street protests across the country. As you can see, globally, there are so many countries that are working to restrict the lives and enact more control over women. And it's not an isolated thing. They are taking this up with legislation. This is big and is happening globally. And we have got to keep our eyes out and keep sharing these stories, because in small ways, women's rights are being, taken care of, chipped away at by these male legislatures. And that's what I hope to share when I'm sharing all of these stories. So join the conversation, share these stories, and don't forget to follow if you're not yet following me.